Hello, Chris, and hello, everybody at your conference at McGill on public policy. A big hello from Brisbane in Australia. I'm sorry that I can't be there, but I've made this short video to speak to your key task, which was to think about, identify and develop the one policy that you would implement in the domain of public health to improve health and well-being. And the answer, very straightforwardly from me, is group-targeted social prescribing. Why is that important? Well, because that's been proven to deal with a range of problems which present in health context, notably at GP surgeries, and in particular problems associated with loneliness and social disconnection. The evidence is that loneliness and social disconnection is growing, and it represents a more potent threat to mortality than a range of really well-known counterindicators for health. Things like lack of exercise, drinking, poor diet, and it's roughly equivalent to smoking 15 cigarettes a day. But we also know that if people are encouraged to join meaningful social groups, then that can have a significant effect in staving off loneliness. For example, if when you retire you lose 2 group memberships, your risk of dying in the next 6 years is 12.1%. If you join or gain 2 group memberships, it's 0.41%. If you've been depressed in the past and you don't join any groups, the chances of relapse is 41%. If you join 2 groups, it's half that, 21%. We know too that people who are struggling with loneliness visit a GP surgery on average 3.74 times in 3 months. But if they join one meaningful social group, that drops to 2.28 times. So interventions that help people to make meaningful connections, deal with this crippling health problem. Implement the policy of choice here from an evidence-based perspective is one that we've developed actually in conjunction with colleagues in Canada, called Groups for Health. And Groups for Health, which effectively brings people into a range of community contexts and helps them to source meaningful groups and then provides scaffolding for them to then live out those group memberships, is one of the few interventions that's been shown to have targeted impact on loneliness. It also, incidentally, is very effective in dealing with depression and social anxiety. It's as effective as the kind of gold standard treatment, which is cognitive behavior therapy. So in targeting loneliness, you can actually target a range of health conditions in this way. But also, I would argue, you deal with a range of social problems which hang around loneliness and which are toxic in the most extreme degree. So Groups for Health, targeted social prescribing, is a policy I think that every country would benefit from. And there's evidence now of uptake of that in the UK, in Australia, and I think the time is ripe for that kind of science-informed implementation around the world, but not least in Canada, of course, because it fits too with much of the work that we have done in the past with colleagues in that space through our connections to the Canadian Institute for Advanced Research. So there it is. I'm happy to talk more about it, but again, I think this is something we really need to identify and hit hard.